Hello, Dorothy Watt, transformational homeopath and holistic wellness advocate, and I'm going to tell you today about my 4 key remedies for using with babies and toddlers. There are 4 remedies that I just wouldn't have been without when I had young children, and I strongly recommend anyone with young children to get these because they make such a difference. The remedies that I'm going to talk about are aconite, belladonna, pulsatilla, and forgotten the 4th one. Aconite, chamomilla, aconite, belladonna, pulsatilla, chamomilla. Yeah, that's it. And these remedies, I'm going to make sure that I tell you about the personality that goes with them. Because when you're dealing with young children, you can't do what you can do with adults. You can't say, what does the pain feel like? Where exactly is the pain? When does it hurt? When does it stop hurting? You're observing, you're watching how they're behaving. And you can find out a bit about where the pain is from watching very carefully. A child who's got an earache, for example, is quite likely to have their hand over their ear. But they might not. So you can tell a bit by that, but you're going to be able to tell more by the appearance of their face, by the sort of look in their eyes, and by their emotions and their wider behaviour. So those are the things that I'm going to concentrate on, really. As I've said before, these remedies, it's not a case of one remedy for earache, one remedy for teething, whatever. There are main remedies for those things, and I will point those out. But if your child's in pain and you think this looks to me like someone who needs aconite, then give them aconite, even if I haven't mentioned that aconite goes with, teething or whatever it is. So really, I'm going to be encouraging you to use your common sense. Now, that's not been terribly awe-inspiring, what I've said so far. So let's go into the 4 remedies and have a look at them in detail. As I've said, they'll cover lots and lots of different things. And it is the sort of the personality of the whole remedy that you're going to be looking for. So I'm going to start with aconite, because that's the one that begins with an A. And aconite is an absolutely fantastic remedy for the really start of a cold. So as a key time, which is round about midnight, and if your child or your baby wakes up round about just after midnight, bright red, dry face, looking really sort of scared and a bit sort of panic-eyed with wide open eyes, bright red cheeks, really hot and dry, then give them some aconite, because aconite is a fantastic remedy for fevers, for teething, for colds, as I've said, for earaches, for headaches, so lots of things that young children might well have. The key things to point you towards aconite, as I've said, you've got the time, midnight, you've got the red cheeks, you've got the sort of panicky look on the face, actually looking a bit scared, sort of quite restless, quite anxious looking. And dryness, as I said, you've got dry skin. If there's a cough, it's a dry barking cough. So you might find that aconite is a fantastic remedy for, there's a thing called croup, which is a really nasty cough that very young children get. Aconite can be an absolutely fantastic remedy for that. If you've got a dry barking cough that's worse round about midnight, I'd say. and has this sort of sleepless, restless, anxious picture with a really sudden start. So 1 minute it's not there, the next minute, you know, clock strikes midnight, there it is. It's quite likely to be aconite. And another way that you can think, oh, I wonder if this is aconite, and this is a bit of a strange one, is there are really key things that can trigger an aconite state. So things that will help upset your body. You know the old wives' tales about things like going out with wet hair in the cold or whatever. Well, there is an old homeopathic wives' tale, which is that cold, dry winds cause the body to be weakened and susceptible in an aconite sort of way. So if you've been out, if you know that you've been out for a really lovely walk and the wind was so cold and so dry, you've been out flying a kite or whatever, cold, dry wind, come back, put them to bed, and then midnight, wake up, dry, red, hot cheeks, maybe a cough, maybe a sore throat, fever, sudden start like that, aconite. Start of a cold, or you know how it feels at the back of your throat, having that sort of dry, burning sort of sensation at the back of your throat, aconite. Okay? Start of a cold, aconite. Midnight, aconite. And the other thing that could trigger an aconite state is actually a huge panic. So if you've been to the playground and you've seen somebody, or your child's seen somebody fall off the swing or something, and your child then goes into a sort of panicky state, or after that, yeah, they wake up at midnight and they seem to be starting to get a cold, or they've got a fever, aconite, it's really good for the, oh my God, they're going to die type of moments. So this real panic and fear. So that severe shock is one of the things that could come before an aconite thing happening. A cold, dry wind. You see that coming, oh, cold, dry wind. Dorothy said something about a cold, dry wind. What was it? What was the remedy that went with the cold, dry wind? Aconite, cold, dry wind. So, this really dry, barking cough, shock, teething. You might have a colicky stomach aches, any sort of intense pain that starts suddenly in the way that I've described, goes with red cheeks that are dry and a sort of panicky, restless type of feeling, worse about midnight. So better for resting, worse for breathing in cold air. So, you know, sometimes if you've got a cough, or you go outside in the cold air, and as soon as you take a breath of cold air in, immediately start coughing. Well, that's a really good sign. Oh, I'll try aconite. So it's worse for the cold, dry air as well. Worse around midnight. So those are the main things for young children and babies. With older children, you could find that fear of going to the doctor, fear of going to the dentist can be helped with some aconite as well. This sudden, again, you'd get that sort of restless, panicky look with the sort of wide open eyes and the reddish skin. You're not going to get somebody looking very pale if they need aconite. So lots and lots of things that can be helped with aconite. Really is a fantastic remedy to have around. So let's just have a look at my cribs sheet, see if I've missed anything. If you've got a child who's old enough to tell you about how they're feeling, a sort of really tight feeling in the chest can come on with aconite as well. There is quite a big cough picture to aconite. And I was talking about dry burning skin. You might get the whites of your eyes going a bit red as well with an aconite cold. So lots of things sort of fitting together there. And now we're going to go on to think about belladonna. Belladonna is another remedy. I'm going to tell you some of the similarities with aconite. It's another remedy that's a real sudden onset. But instead of being fearful, a belladonna picture is really angry. So they're crying, really fit to burst, and so you can tell that it's an anger behind it rather than a fear. So bright red, sudden start. You remember aconite was a sudden start round about midnight? This is a sudden start round about 3 o'clock in the afternoon. So I can remember when mine were little and they had their afternoon naps. We had this thing in the mums group where they'd sort of take in turns to wake up after their afternoon nap with a fever, crying, and it would be about 3 o'clock in the afternoon. Belladonna, that's the key remedy for that time. So it's another one that's got dry, red, hot, burning skin, particularly the cheeks, and in the case of belladonna, particularly the ears as well, maybe bright red, really thirsty, staring eyes with big pupils, but you've not got the fear behind it, you've got the anger. And belladonna is actually made from atropine, which is what is the drug that's used to dilate people's pupils. You get atropine eye drops if you have to go and have some eye surgery. So it goes with the fact that with belladonna, which is very dilute form, but made from the same source. So that's one of the symptoms that you get with belladonna, is these large pupils. So it can be a bit of a sort of mad looking picture, and the fever can get quite high, and I'm not suggesting that you stay out of your comfort zone with a fever. If the fever gets higher than you're comfortable with, then of course you ring 111 or you get some help and advice from healthcare professionals. But this is really, this is your first port of call. This is something that you can do to nip things in the bud and mean that you often won't need to go and get antibiotics or get anything else, because you can nip it in its tracks. Stop it in its tracks, nip it in the bud. That's the one I'm trying to say. Right. So aconite, there's no particular side that is preferred for the symptoms being worse. But belladonna, the symptoms are worse on the right side. Yeah, that's the right side. So the earache is likely to be the right ear. You might get teething that's right on the right side. You might get a headache that's right-sided headache. Okay, so if you've got a child going like this, and they're red and hot, 3 o'clock in the afternoon, again, that's a really good thing. Oh, what did Dorothy say? Let's try some belladonna. They're usually so nice. They're usually such a calm child. Now they've turned into this absolute angry monster. Try some belladonna. Can work absolute wonders. So what makes belladonna, what makes you sort of susceptible to something belladonna-y happening? Well, it can be draught, so that's a bit similar to the aconite. And this really is the old wives' tale one about getting your head wet, getting cold while your head is wet. I've got one client, and her she goes swimming, at school in the afternoons, and Mum said the day after she goes swimming, she always has a cold. Belladonna. Getting getting your head cold because your hair's wet when you come out of the swimming pool. And as I mentioned again, this is another really sudden start. There's a lot of sensitivity here to things that are going to make you really, really annoyed and really cross. So the sorts of things that will make somebody feel worse when they've woken up at 3 o'clock in the afternoon and they're really angry is bright light. And of course 3 o'clock in the afternoon, the sun's often shining. We're talking about daylight time. Bright light, loud noise, touch, sudden movement are all going to make the pain much worse. You know, sort of when you take a step and it jars up through your body and you get this sort of reverberation of pain. It's called jarring. And if you've got a headache that's a belladonna headache, it almost feels as if your brain's being pushed from side to side. So that sort of sudden movement that makes you feel really, really awful and so bad-tempered. Worse for being in the heat of the sun as well. So it's the sort of remedy which, if I was on holiday, and we're talking about, you know, being in the summer sun now, if I was on holiday with a child and they'd got a bit too much sun, it was a bit too hot, middle of the afternoon, they suddenly got really bright red and bad-tempered and seemed to be in so much pain, really thirsty, wanting lots to drink, I would give them some belladonna because it's actually a really good sunstroke remedy as well. And just that bit too much sun can be enough to push your system over the edge. We're talking about our bodies just being pushed out of balance by something that makes them uncomfortable. So worse in a draft, and worse, as I've said, for getting your head cold and wet. Better. Now there are some characteristic things here that might help you think, no, that's interesting. They were really screaming flat out when they were lying flat, but now that they're propped with their heads up a bit, sort of half sitting up, they seem to be better. Maybe that's belladonna. Being held. Oh, well, there's quite a lot of remedies that could be, and I think that's possibly more likely to be the one we're going to cover next. But it could be belladonna if everything else fits. Better for being covered with a light sheet. So not being uncovered when you're hot. You know, the first thing you're told to do in conventional medicine is if they've got a fever, if they've got a high temperature, you strip them off and you help them get their temperature down. Well, homeopathically speaking, and I'm not talking about really extreme temperatures, but homeopathically speaking, your body has a temperature because it's your body's way of fighting the germs. If you do everything you can to bring that temperature back down against the wishes of your body, you know, you're taking some paracetamol solution or you're stripping all the clothing off, you're fighting against the body in a way and help you stay sicker, possibly, because the body's trying to heat up to help bake out the germs, basically. And if belladonna looks as if it's the sort of remedy that you want, rather than being better when they're stripped off, they're better when they've just got a light sheet on top of them. You know, some children really just don't like having all the covers off them. Even when it's really, really hot weather, they just like to be covered with something. And that's an indicator for belladonna. And they're better in a dark room. Makes sense, doesn't it? Because if they're worse for bright light, if they're worse for loud noise, all these things, being in a dark room is much more likely to be quieter and just let them rest a bit. So I hope that's given you a picture for what belladonna's like. So it's really 3 o'clock in the afternoon, for the sudden start of the symptoms. A child who's usually very mild-mannered suddenly gets really angry and really bright red. That's a good thing to go for. And it could be earache, which is likely to be worse on the right-hand side. It could be teething, likely again to be worse on the right side. It could be a headache, could be worse on the right side. It could be a sore throat, it could be sunstroke. Any of those things in your young child, if it fits that picture, particularly if, you know, so when I was saying on the beach with having got too much sun, that fits the possibly getting your head cold when it was wet if they'd been in the sea. Yeah, which could just push them over to the edge in this state. I hadn't put all those pieces together before. Worth taking to the beach, I would say. Belladonna, really good one. Now, if you've got young children, it's possible that you are going to be breastfeeding, and engorged breasts, so worse for 3 o'clock in the afternoon, you know, better for lying down, resting quietly, worse for jar, for movement, for all those things. Try belladonna for your engorged breast. It may well help. May save you some antibiotics for your mastitis if you can actually get on top of it. And it could just be that your child's had a growth spurt, so that you're producing that extra milk for them now, and they're not quite keeping up with the amount that you're making. Try belladonna, could really help you as well. So that's another really, really useful remedy to think about. So we've gone A, B, and we are going to go C now. And C is chamomilla. Chamomilla, oh, you might have heard of that one, because it's a fantastic remedy for teething. It's the #1 remedy for teething. I have said that belladonna and aconite are good teething remedies if the picture fits. So if your child seems really scared and restless, go for the aconite. If they seem, you know, really angry and fit that picture, go for the belladonna. But most children, when they're teething, chamomilla will work absolute wonders. And I can remember giving this to my children, giving them to anyone else's toddler who was round, who was teething, and converting several mums to homeopathy in the process. You may still be able to get some teething powders, which are homeopathic chamomilla over the counter. If so, you might find those really, really useful. It works a charm. Now, chamomilla isn't just for teething, it's also for a really good remedy for earache and for colic and diarrhoea and for other colicky pains. So we're thinking older than young children now, but period pains, labour pains can also fit a chamomilla picture. And chamomilla does not have a pleasant picture at all. We're talking anger, but it's not the same sort of violent temper as belladonna. This is a really rude type of anger and unpleasant, really self-centered behaviour, because someone who needs chamomilla is so sensitive to the pain that they are beside themselves and they cannot control what they're doing. And all they know is that they need this pain to stop. It's just come back to me, and I will mention it now while I think of it. I recognised this behaviour in my teenage daughter when she had braces fitted, and I thought, this is like teething. And I thought, oh, of course it's like teething. Very sensitive to pain, a lot of pain concentrated in their mouth that there's nothing you can do about, and you just want it to stop. So it's a fantastic brace wearing, when they're tightened. Chamomilla, again, brilliant remedy. So beside themselves with the pain, they are so irritable, so angry, and really hard to please. So they don't know what they want, or if they do know what they want and you give it to them, then they don't want it and they throw it away. You can try so hard to please them, but they actually don't want to be pleased. They just want the pain to stop. And just about the only thing that makes them feel better, apart from chamomilla, is being carried around and moving very fast. So you carry them, but it's not about you standing still. You end up moving around the room and doing everything you can to sort of distract their system from the pain. Chewing down on a teether actually makes them feel worse. So that could be something else, that you give them a teether and they throw it away, and that could be an indication that it's chamomilla, just because actually it really doesn't help giving them something to bite on. And this is a remedy that is better for being uncovered. So belladonna likes to be covered by a sheet. Chamomilla really feels better. They're kicking off the bedclothes, kicking off the covers. Cold drinks make them feel better. And they're much worse in the evening, at night. So you put them down and they won't settle, and they're up, and you put them down and they're up, and you put them down and they're up. And you recognise this, don't you? So you end up picking them up and carrying them round. Chamomilla. And it's often when they're teething that they've got this behaviour pattern. And I mentioned it can be useful for colic, useful for diarrhoea. The characteristic diarrhoea is a sort of a greenish tinge to it. So you often find that happens when they're teething. So that's another way of thinking, oh, chamomilla. Yeah, it's green. Oh, Dorothy said something about green diarrhoea. Teething. Oh, yes. Let's try some chamomilla. So what you're really looking for here as a sort of cause for thinking about what might have caused this behaviour. Teething, if you know they've got teeth coming, then chamomilla is a good one to go for, regardless. If they have got angry about something, so if even really, really young babies do get angry about things, and it can just be pain that won't go away that makes them angry, or it could be that you haven't come to them quickly enough to feed them, or whatever it is. If you notice this behaviour pattern, think, what happened before? Oh yes, that might have made them cross. Colicky pains, bit of diarrhoea, maybe teething, could be earache. So when we've talked about the belladonna and the aconite, they both had really red cheeks, really red, dry skin, particularly the cheeks, but quite generally red. With chamomilla, you've got the redness in one specific place. So if you know there's a tooth coming here, and you see a red patch on the cheek just there, that's a good sign. Now think about it. I mean, all the blood's going to that part of the jaw, because a lot of work's having to happen for the teeth to break through. It's hard work, isn't it? And it's a painful process. So it's not surprising that you might see that red patch, and that is a good indicator that chamomilla is your remedy. And it could mean also that if it's an earache, that you've got one red ear, and if you recognise this behaviour, this anger, this real irritability, this want something, you give it to them, they throw it away, they really can't please them with anything, chamomilla is a really good one to go for. They really don't like being put down on their own in a bed or in a cot. I didn't mean being put down terminally, I meant being put into their cot. Again, it's worse for a cold wind, but this is a cold damp wind rather than the cold dry wind, which was the aconite. Evening and night, as I've said, is the worst time of the day. Yeah, the time when you're worn out as well, and it really doesn't help, does it? But there you go. And I mentioned labour pains. So if you are aware, if you can think back to when you've been in labour, and if you can remember yourself being so rude to the midwife or rude to your birthing partner or whoever because you were in so much pain and you were so tired and you'd had enough, maybe some chamomilla would have helped you too. And if you're pregnant again, if you're planning another labour, or I should say if you're planning another pregnancy, if you're pregnant, you're going to have the labour. But it might help you to have some homeopathic remedies with you then, because if you know that that's the sort of picture that happens to you when you're in labour, that could really ease your pains. So very, very useful. 3 pain remedies there, a lot of similarities between them, but there were clear differences, which I hope will be really useful for you. And I will say at this point that Helios Homeopathic Pharmacy do sell a remedy that is called ABC, and it is composed of aconite, belladonna and chamomilla. And they sell it as sort of like a homeopathic painkiller for children. Because, as I've described, you know, all 3 remedies are very good for teething, for headaches, for earaches, for colicky pains, for temperatures. But rather than just lowering the fever or suppressing the pain, which you would get with the conventional medicine, this is actually supporting your baby, your young child, to help their body cope with the symptoms better so that they come back towards a state of balance. So you're not suppressing anything. You're actually helping them get through this painful condition faster. So 3 really good remedies there. And if you aren't sure which one to go for, if Helios, which is a homeopathic pharmacy, if they put 3 together in one pill, then just alternate aconite, belladonna, chamomilla. Or get a little pot and put several aconite, several belladonna, several chamomilla in one pot. Stir it up. They'll all talk to each other, all those remedies in that pot. And then you just take one and give it to your child. With the baby, you'll have to crush it or put it in water. So you can put ABC in the water and then just give them a little spoonful, and that would be just a fantastic relief for them and for you as well, because it's really hard work, isn't it, when you've got children who aren't well and you just want them to be better. So aconite, belladonna, chamomilla, or all 3 together. It's no admission of failure, and it may give enhanced support to your baby or your young child. Now the 4th remedy that I'm going to talk about is pulsatilla. So pulsatilla is also good for a lot of those things that we've talked about. It's really good for colds. It's really good for earaches. Earaches are often worse on the left-hand side. And it's also really good for separation anxiety. So this is the remedy for if your child if you're taking them to nursery and you know that they aren't keen on being left and they're really anxious that you won't come back for them again, they cling to you when it's time for you to leave, then you can make that separation process easier if you give them some pulsatilla. It does work really very well. I'm not suggesting that it's a cold calculating thing to do and you can just brush off their insecurities. You're supporting their system to handle this this difficult situation more easily. But it is important that they do learn to cope with a bit of discomfort. But if it's got beyond a joke and this separation has to happen, then pulsatilla surely must be better than letting them really, really, really scream their poor little hearts out for half an hour every time you leave them in the morning. So, how would you recognise a pulsatilla state? Well, it isn't just the separation anxiety. It's a lot of colds as well, particularly children's colds. You recognise the pulsatilla state because they feel very sorry for themselves and they really don't like being left on their own. And when they feel sorry for themselves, they want attention and they want to be cuddled, and there's just something about them that really makes you want to cuddle them and you feel really sorry for them. Now compare that to the chamomilla wanting to be held, wanting to be carried, not wanting to be put down. They are so angry and they throw away everything that you try to give them that actually you don't feel sorry for them. So that's quite a good way of distinguishing between the chamomilla and the pulsatilla. The pulsatilla, you do feel sorry for them, even when their behaviour can be quite bad. The chamomilla, you really don't feel very sorry for them because you just don't. There's something about the rudeness and the anger that is very different from the pulsatilla one. Pulsatilla, again, you can tell when a child needs the pulsatilla state because they're just not thirsty. They are just not thirsty at all. I talk to so many mums who say they just won't drink. They just won't drink. They come back from school and they've still got a full hot water bottle. Yeah, they've still got a full water bottle. Now that isn't always the child because sometimes it can be quite difficult for them to get to their water bottle in school. But some of it is that they're just not thirsty. Or if they're thirsty, they just have no desire to drink. And it really is a pulsatillary thing. There tend to be frequent colds, which are really snotty colds. And they're the ones with the yellowy green mucus going down the nose, down the face, down the chin, down their front. You've all seen that, haven't you? And sort of the tears and just looking really sad. Pulsatilla will really help that cold. Speed it through, make the cold a bit milder. Really support the child so that they don't have as many problems with it. There's a cough with pulsatilla which tends to be worse in the morning, and it's quite a wet cough in the morning, so it's quite productive. They're bringing up quite a lot of gunge in the morning, which, as I said, is yellowy green. And then they stop coughing during the day and they start coughing again in the evening, but the cough in the evening's different, so it's a really dry cough in the evening. So that's a good pattern to remember. And pulsatilla feel rubbish in the mornings and they feel rubbish in the evenings, but during the day actually they feel much better. So you might recognise this pattern as well. It's the child who is too poorly in the morning to go to school, and then they're up and about outside having a whale of a time all day, and you think they could have gone in, but they really weren't well in the morning. It's a pulsatilla picture. Not only is pulsatilla worse in the morning and the evening and much better in the daytime, but they're much better outside. So getting that fresh air is much better than being in a warm, stuffy room. Warm, stuffy rooms make them feel much worse. So again, like the Camomilla picture, pulsatilla children like to kick off the covers because they cannot stand this stuffiness and they'd much rather be cool. And they are if you recognise all of those pulsatilla symptoms and you think, but it's an earache that they've got, I can tell it's in their ear, so I'm going to give them something warm. Well, the warm, stuffy room makes them feel worse. Being outside in the cool air makes them feel better, and they'll feel better. Their ear will feel better if you give them a cold compress to put on it. I said left ear. A cold compress to put on their ear if they're in this mopey sorry for themselves state and their ear is really hurting. And similarly, if you find a child who's got their teeth coming through and they're putting a cold tissue on it, again, think pulsatilla. It's always worth a try. You haven't lost anything. If it's the wrong remedy, you haven't lost anything and you haven't made anything any worse, and you might really help them. So another aspect of the colds, and the reason that you get your wet cough in the morning and I need to plug in my charger. The reason you get your wet cough in the morning and it dries up during the day is that colds go to the sinuses. These ones here and these ones here can get really congested. And when you've been lying down overnight, these get really, all the mucus gets pulled up in those sinuses, and then that drains first thing in the morning, which is why draining down your throat, down the nose, that's why you feel worse in the morning, because you've got all this congestion. That's why you're coughing all that up. And then once you've been up and about for a bit, particularly outside having a nice time, then in the evening your cough is drier because the sinuses are drained already. So for adults as well, any age, man flu works, is quite often pulsatilla. You might recognise the emotional picture there, feeling very sorry for themselves, moping about. Try some pulsatilla, you never know. But sinuses, again, when it's worse in the morning, worse in the evening, give pulsatilla a go. It really is a very good sinus remedy. And the other thing that I haven't mentioned is it's worth a go for styes. You know, when you get those little boils on the eyelids, pulsatilla's, it's not always the right remedy, but it's worth a go for that. And also indigestion, sort of children who get a tummy ache, sort of particularly if they weren't keen on going to a birthday party, and then they get there and then there's lots of rich party food, they are quite likely to get a tummy ache. Or they could be the sort of child who's had such a nice time at a party and they've had so much to eat, that all this really rich party food that they wouldn't normally be having, they come home and then they haven't got their friends with them anymore. And if they then get a tummy ache that evening, again, pulsatilla's worth a go if it's sort of this mopey sorry for yourself, being abandoned, left on your own, that sort of picture. So adults as well, you can find that pulsatilla is a really good indigestion remedy, especially around Christmas time. If you've got a significant person who isn't at a Christmas feast or a festive meal, or there's an anniversary or something and a significant person is missing, maybe a relationship's broken down, or maybe somebody's died, or maybe they're too ill to be there. If somebody just starts feeling queasy, loses their appetite and doesn't drink anything, just try pulsatilla, because it's that abandonment picture, that feeling unloved, feeling left. It's worth a go. As I've said, for all these remedies, it really is worth looking at the emotions that go with it. That's why I've talked about them for each of those remedies, and I hope given you quite a clear picture that differentiates between the 4 of those remedies, because that is what you're going to be relying on when you're dealing with young children. They can't tell you in the way that older children can what hurts, where it hurts. So it's going to be far more your observation and what you know of your child normally and how they're different from normal. So that's your 4 remedies. Now I'm going to quickly go through and I'm going to tell you a bit about how to take the remedies, because it's very different from conventional medicine that you might be used to. So with a conventional medicine approach, for if you've got some Calpol or something like that hanging around and that's your first port of call when someone's not well, you put it off and you put it off and you put it off, and you see how long you can not give it before you give in. With the homeopathic remedies, actually, because you're not suppressing the pain, you're not suppressing the symptoms, you're actually supporting the body to come back so that it's more in a state of balance. All of those symptoms are really the body saying, I'm struggling now, please help me. And that's what you're doing by giving them the remedies. And it works much better the sooner you give the remedies. So don't put it off and put it off and put it off. As soon as you notice that teething behaviour, as soon as you notice the earache, or 3 o'clock in the afternoon if you see these bright red cheeks and the angry child, midnight if you see this restless, sleepless, panicky child with red cheeks, give them the aconite, give them the belladonna as soon as you can. And these are little white sugar pills. So if your child's old enough to be able to crunch them in their teeth, then that's absolutely fine. But if your children are younger than that, what you might want to do is just boil some water, let it cool down, and then you can dissolve some of the little pills in the water and just use a spoon or clean finger, dip it in and then dip it in their mouth, and they will get the remedy that way. Because if you've dissolved the remedies in the water, as long as your finger is still wet, you've still got some of that remedy in the wetness that's on your finger. So as soon as you can, soon after the symptoms start, you give one remedy. What I would then say is, if you've chosen the right remedy, you will get quite a rapid decrease in symptoms. And when I say quite rapid, I mean, say, over the course of a minute or 2, you will notice quite a big difference. And I know when I've taken remedies myself, if I've taken one for an insect bite or something that's really itching me, I think, oh, I'll just take something. And I'll take it, and then I will just forget about it. And then a little bit later I think, oh, that's not itching anymore. So it's sort of a strange way of noticing that the pain or the discomfort's gone sometimes. But what you will find, and this is different from the conventional medicine, what you will find is that the amount of remedy that you get in one little pill gets used up by the body quite quickly. And if you think of all the energy that's being used for these tempers, all these extreme reactions to the pain which young children have, because how else can they express themselves? They burn it off. They use up the remedy really quickly, and you may find that even after 5-10 minutes, even after it's really died down, it suddenly comes back again, and you think, but I thought I'd got it. I thought I'd chosen the right remedy. This was really helping. It's obviously not the right remedy. The symptoms have come back. No, it was the right remedy because the symptoms died down. The child's body has used up all of the energy in that remedy. You need to give them another dose. You need to give them another spoonful. You need to dip your finger again, give them another little bit in their mouth. Give them another pilule. And then when you do that, you'll find that the symptoms die down again. And you think, oh yeah, so it was right after all. And then the second one, you'll find lasts a bit longer. So you may get, say, half an hour's relief this time. Think, oh yeah, I have cracked it. And then the symptoms come back again. Think, oh! But now you know what's going on, don't you? Now you know. You just need to give another dose. So you give another dose, and this time the relief will last for 1 or 2 hours. And then it'll wear off again, and then you give another dose. And that's how you work out, actually, when you need to give another remedy. It's when the symptoms come back. But you've got other things to be doing with your time than watching all of the time. I have found that it is really worthwhile doing this for the first 3 doses. You're priming the body with 3 doses quite quickly, and it's not what it'll say on any of the packets or any of the bottles that you get from Weleda or Helios or Ainsworth's. They'll all just say 3 times a day or something like that. But I have found, and the people who've tried it, doing it the way I suggest, have found that it really does help knock things on the head more quickly, because your body needs more of the remedy to start with. So you take one straight away. As soon as the symptoms come back, you take another one. As soon as the symptoms come back, you take another one. As soon as the symptoms come back, you take another one. And then after that, I think it's safe just to go 3 times a day. But it is worth doing that pump priming to start with. Okay? And what you do, so I've said about taking the first dose as soon as you can. I've said about crunching it up, or you can put it in your mouth and just put it under your tongue and let it dissolve that way. What you don't want to be doing, and we're talking about, babies and toddlers, so it's not so much of an issue here, but you don't want to be trying to swig down one of these little pilules with a glass of water. That's how you would take a paracetamol, and it's not what you do with homeopathic remedies. You want them to get into your bloodstream as quickly as possible, and keeping them in your mouth is the way to do that. So that's the best way of taking the remedies, and I really suggest storing them away from energy sources. I've talked about energy a few times, haven't I? I've said you use up the energy of the remedy. I'm very much of the opinion that homeopathic remedies are an energetic medicine, and you're giving the body back energy that it's missing. So if you think of them in that way, I'm less concerned about, I know a lot of homeopaths say don't take anything with peppermint anywhere near them, don't take coffee anywhere near them, don't take it, 20 minutes either side of food. I'm not convinced by that, because if your child is very sick or if your child is very disabled, the way I would recommend giving them the remedies is either in water or in the food, and the remedies still work. So I don't hold with this about keeping them away from food and mint and coffee, things like that. But what I do reckon is important is, because they're an energetic medicine, I would keep them away from strong energy sources. So I would keep them away from your mobile phone, and I'd keep them away from your computer, and I'd keep them away from bright sunlight, because those are all really strong energy sources, and I don't actually know what those energy sources will do to the remedies, but I'd rather not risk it. So that's the best thing to do for that. So when I say keep them away from your mobile phone, if you want to take them out and about with you, and I would really recommend that you do for some of these remedies, just priceless to have them with you. If you've got your phone one side of your bag, put the remedies over the other side of your bag in an outside pocket or something. I'm not saying it has to be miles away. And that's, let's talk through that one. When to seek professional help. Now, what I'm talking about in all of these Facebook Lives is I'm talking about everyday events. I'm talking about the sorts of coughs, colds, headaches, earaches, teething, which are a fact of everyday life, and they're just annoying. And they make a huge difference to our quality of life, but they are not life-threatening. And if you have any of these symptoms, and to you they don't seem part of the normal everyday run-of-the-mill, if you think, I'm really not sure, I really don't think this is a normal thing, then go and get some medical help. Go to A&E, dial 111, go and see your GP, whatever. I'm not saying that this is a substitute for medical advice, but it's a way of nipping things in the bud, these sort of everyday things that really can make a huge difference to your life. If you think, well, this is brilliant, this is really good, but my child's getting so many colds, one after the other, after the other, after the other, and this just isn't normal. They've got so many more than all the other children in their class. Or I've tried all those particular remedies for the teething, and they really are struggling. Or there's something that is, you can see it's run of the mill, but it's not being helped by the remedies that you've got, then go and see a professional homeopath. And you can then get exactly the right remedy, because homeopaths have thousands of remedies to choose from, not the 4 that I'm just suggesting for you. Now, where can you get the remedies from? Well, there are several sources. I've mentioned Helios, Walida and Ainsworth. They're all sources of homeopathic remedies. Helios Homeopathic Pharmacy and Ainsworth as well do these boxes which have a small number of remedies in. This Helios box has got 18 remedies in, and all 4 remedies that I've talked about today are in this box. So if you've got this, then you've now got a bit more of an idea how to use it. If you haven't, you can get the remedies online. I used to be able to say you could go to Holland and Barrett and get them, or you could go to Boots, but nowadays you actually can't. Nowhere that I've found, unless you happen to be near a homeopathic pharmacy, nowhere sells them retail anymore. If you really think that it would be so useful to have the 4 remedies that I've talked about today, because you've got young children and you can see from what I've described that this would really help, then I have packaged up these 4 little files with the pilules in, so you can see actually what they look like. Get them in focus there. So they're little white sugar pills. As I say, you can dissolve them in water if you've got young children. These don't crush very easily with a spoon. You're better off dissolving them, and older children can just crunch them up in their mouth. So if you think a kit like this would be fantastic for you, because actually all you want is those 4 remedies, because that's all you can cope with, and from what you've heard, that's really going to help. And you can just keep it somewhere. You keep it in your changing bag, or you can keep it wherever, and you know that having any more than that would not help. It would deter you from using it. Then I sell these on my website, and I call them out and about kits, because that's exactly what they are. These are fantastic little boxes. You can just slip them into a pocket, into a handbag, into a changing bag, backpack, whatever, and take it out and about with you, or keep one in your desk drawer. Well, maybe not the baby one, but some of the other ones. Fantastically useful, and they come with a chart which summarises all of the 4 remedies that I've talked about today, and the chart looks like this. So you get, for each of the 4 remedies, you get what the symptoms are, what causes it to start in the first place, what makes it better, what makes it worse, and you get that for each of the 4 remedies, all on one page, and then you get a page telling you how to store them, and reminding you about that dosing thing that I talked about. You know, the 3 doses really quite quickly, one after the other at the beginning, and you get a picture to remind you about that, and you can print that out. And you can get these off my website, and they're £40, and then I'll put them in the post to you. And I think they're so fantastically useful. And if that's the way you think, and if that's the way you work, and having 4 remedies like that would really help you, then brilliant. Go to my website. It's under oh, I can't remember where it's under. It's on my website, and it's under courses. It's under courses and workshops. You have to scroll down, and then you get to out and about kits, and then you can click on a box and buy the one you're interested in, and I will pop it in the post to you. I hope you found that useful, and see you soon. Bye for now.